exam. And here to explain and break it down is Dr. Amir Karam. He is a Carmel Valley facial plastic surgeon. So thank you so much for being here.
Thank you for having me.
So first of all, can you explain this bill and when every plastic surgeon across the board would have to abide by it?
Sure. Well, technically, I would imagine that this type of information means immediate action. Right? Most plastic surgeons, by the very nature of our training and the very nature of surgical training, should be doing these steps regardless of a law. But this emphasizes the importance of mandatory testing, both in terms of getting an adequate history, a good physical exam, the proper lab work, and if the patient requires certain preoperative clearance by sending them to, say, for example, if they have a pre-existing heart condition, sending them to a cardiologist to work them up appropriately and discover anything that may make them a poor surgical candidate before they go into the operating room.
Okay, so many people already do require the physical exam for their own groups, but you're saying across the board this would happen. With Donda West, this kind of pushed it into the limelight, if you will, and let's talk about her case for a minute. Sure. Because she had some kind of pre-existing heart condition. Yeah, and that's apparently, you know, again, all the details of the case are sort of confusing and convoluted, but apparently there was some pre-existing issues that may have made her a poor candidate for certain type of long elective surgery, and that's what this type of law really tries to emphasize, is that elective cosmetic surgery is like any other surgery. So the same sort of rigid requirements that go into figuring out if somebody is a good candidate for surgery or is safe to undergo general anesthesia and all that other types of you know, challenges with the surgery have to be discovered preoperatively. So right now the requirement then is it's just a questionnaire really to find out if you're a healthy candidate. And in talking about this during the break and with our Booker producer, whose aunt is an anesthesiologist, she was saying that some people don't want to disclose everything. They don't want to say that they're using herbal supplements, or maybe they forgot. And have you found a lot of cases of that? You know, it's true. And what ends up happening is I think the public in general sort of downplays what cosmetic surgery is. They think it's a little bit less invasive, safer than any other type of surgery. So when you do ask those questions, you know, what type of medicine are you on, what type of, you know, even including herbal medicine, sometimes patients don't always disclose that. And the fact is, a lot of those herbal medicines can cause issues with bleeding and heart problems and pressure issues, things like that need to be discovered you know, before they go into the operating room, so that the proper steps can be taken to manage them. Do you think this bill is a good idea then for your industry? Yeah, I think it is. I definitely, absolutely. I mean, you know, safety is the most important aspect when it comes to elective cosmetic surgery, and this really, you know, emphasizes the importance of going through the right steps. And like I said, I think the majority of you know, surgeons who've gone through their training, this is second nature. You know, this is one of the first things that are taught to us in our internships is if you're going to take a patient to the operating room, you get a good history exam, you get the right type of physical. All these things have to be signed off before you go into the operating room. But this really emphasizes that in practice, when you're done with all of that, that you continue on those good habits. All right, Dr. Karam, thanks so much for being here. We're out of time. It's nice to have you in this morning and explaining how it all works. Thank you very much.